Welcome to the Dr. Frank and Steve podcast with your hosts, Dr. Frank Williams and Dr. Steve Snodgrass, MD, FACS, where we discuss a broad range of topics without limitations. Let's get to it. Here's Dr. Frank and Dr. Steve.
Hello, welcome back. This is the Dr. Frank and Steve podcast. I'm your host, Frank Williams. This is Dr. Steven Snodgrass. We're going to continue on our series. As we said, last time we covered gut health. Today we're going to cover a subject that's becoming mainstream, but is still not quite there yet, especially in the pediatric realm, even though it's got a high success ratio, which is called fecal transplant. So if you thought you couldn't live without the last one, we know you can't live without this one. So it's very fascinating, even though the subject matter is not the most entertaining. It's definitely descriptive and can help you, especially for someone who's, troubled with or suffering from gastrointestinal problems. So without further ado, I'm going to let Dr. Steven Snodgrass, without making a pun, get right into it.
Well, thank you. And as you say, this is just an extension of the gut health podcast that we did, but it's something that I think that can be thought-provoking as well as entertaining,
Yes.
So here we go.
With us, anyway.
Yes, but I'm going to say, I've always said this, that feces is the great equalizer. In other words, like no matter who you are, rich, poor, this, that, everybody poops. That's all there is to it. And it's my understanding that at some point, there were people in North Korea who thought that their leader would not clear poop. But that would be a sad mistake, because if you don't, you're going to die.
Yes.
So let's just get that over with now. Again, this is just talking about the microbiome and diseases like Crohn's disease and ulcerative colitis, both examples of inflammatory bowel disease. And we also want to go over clostridium, difficile infection, or C. diff infection. And the thing that I found pretty fascinating was that the first use of fecal transplant documented was 400 AD in China, where yellow soup was used to treat people with diarrhea. And yellow soup is a broth containing dried or fermented stool from a healthy person.
Yes. And you know what? It's also traced back to, the Hindu cultures as well. All those, that's what somebody was going to say, all those cultures used it and you might be getting ready to cover this, from camel dung to just that, different, not just people, but also animals they used back in, especially during World War II, that was used. Did you know that?
Well, the thing that I learned was over 100 years ago, it's been involved in animals, but horses were one of the main animals where they used it.
Right.
So I found that to be very interesting. And C. diff is first documented in 1958. And in the last 15 years, C. diff infections have become a lot more prevalent. And there's about 3 million infections a year, roughly 50,000 deaths per year. And this is a disease that takes place usually in an outpatient setting, nursing homes, things like that, but it is becoming more prevalent in younger populations.
Right.
But for what it's worth, for the people out there who are microbiologists, a gram-positive spore-forming bacteria that happens because people get on antibiotics. And this is one of the main points I want to bring about, is that people get on antibiotics alter the gut flora. C. difficile is everywhere. It's under our feet, it's in the soil, it's in the water, it's everywhere on surfaces. But we fight it off with a healthy immune system. But in somebody who's taking antibiotics, the antibiotics will kill off some of the good bacteria and allow C. difficile to proliferate. When it does, it can cause severe disease, including death, as we alluded to.
Mhm.
And I've seen a lot of cases of it, and you know, it's remarkable. People are so sick when they have a bad infection, and up to 10 to 15 diarrhea stools a day containing blood and pus, dehydration, septicemia, toxic megacolon. I've seen it cause toxic megacolon, where the colon blows up like the size of a basketball.
Oh,
And
wow.
you have to go in there and, you know, you have to go in there and remove that section of colon to save their life, because it's just seeping bacteria into the bloodstream. And it's a very, very serious disease. And, you know, you can get this from drinking lake water. So it's just one of the things where if you're younger, you think like, oh, it's not a disease that I'm going to get, but it's becoming more and more prevalent. And it's really the only, right now, it's the only FDA approved use is for recurrent C. diff infection.
Yeah, because most insurance companies, we're not saying all, will cover the procedures for that.
It's, I've read where the FDA has approved 2 fecal microbiota products. One is called a Rebiota, and it's administered rectally, and the other is Faust, which is fecal microbiota that's spores that are orally ingested via a capsule.
Yeah, or what about, and for kids, I think, don't they do that, what's it, nasogastric tube or something?
Yeah, I mean, there's different ways to administer it. I mean,
That's for kids.
Yeah, you can take, you know, the pills can do it, or you can look at an NG or nasogastric tube. That's another way. If it's basically involving the rectum and sigmoid colon, you can use a flexible sigmoidoscope.
Mhm.
You can also use an enema, or a colonoscopy is the most effective
Well, the
route.
surgeon does that, correct?
A surgeon or gastroenterologist, you know, either one. But that's one of the things that they're looking at. And also, you know, the FDA is kind of like looking at, well, is this a drug or is this a body fluid like blood? So, you know, there's going to be some regulatory changes that are going to take place. You just have to reevaluate.
Yeah, because there
those.
haven't been a lot of long-term studies done on this, have there?
No, there really have not. And you know, during the fecal transplant, the microbiome is altered. It restores normal, healthy flora to the recipient. And we don't know if that's due to like one or more bacteria, if there's, you know, one bacteria that's specifically causing all the benefits, or multiple, but eventually, you know, they're going to be evaluating that to kind of narrow it down to where it's like, okay, it's that bacteria. And just to narrow it down to 1 or 2 bacteria. And so there's a lot of different studies that are going on in regards to that now. And one of the things that I thought was pretty fascinating, let's see, I wanted to go over this, is like if a fat person who is a recipient and it gets stool from a skinny person, then the fat person starts to lose weight. If a skinny person receives a donation from a fat person, the skinny person starts to gain weight. So,
It'll be the next thing on TV that you can call and do a 5-minute consultation and have your kit sent to you. Take the pill, stick it down your nose, put a couple ounces in there, and you know.
Well,
there's
there's-
this weight loss drug.
well, I've got an interesting thing here that I came up with, and you're gonna call me crazy, and you know, you may be right.
Yeah.
But I'm gonna make a prediction here. I'm gonna say you heard it here first. I call it interspecies feces. So this is what I'm thinking. And you know the world's crazy, right?
Yeah.
What have you seen in this world? Really?
Literally everything.
It's everything, right? So I don't think this is too far-fetched. But if it makes a fat person gets something from a skinny person and it makes them lose weight. Let's just say, for example, what would happen? Well, what would happen if you took the best, fastest racehorse in the world, and then you've got like a track star, an absolute like phenom, or maybe they're not, maybe they're just middle of the road. They get a fecal transplant involving horse manure, will make them run fast. Think about it.
They can change their name to Mr. Ed.
Absolutely, or Secretariat, whatever. But I'm just saying, I know you think that's crazy, and you all may too, but I think it's gonna happen. I really do. It's not gonna be for a long time, but you just remember, interspecies feces. How about that?
You know, I found it doing the research that, you know, since it's a pretty quick procedure, even if you're doing the colonoscopy, but if you're not, I mean, it's an outpatient procedure. But, you know, the NIH, National Institute for Health, and several other sources, from the CDC you can find, says it's like low or no odor. And to say no odor, I'm gonna call that bull. And it says it costs less than a lot of the different antibiotics, and it really has no side effects after the first couple of days, because you can have side effects, supposedly, you know, gastrointestinal side effects for 2 or 3 days, and then usually they subside and they're gone. But I never knew this was a thing until you started talking about it, bringing up with the gut health issues, and I thought, you know, and that's the first thing I thought. This is going to start becoming a mainstream way, just like you can get those GL1s or whatever prescription over the internet or through your phone app or whatever. This is going to start being able where they can actually probably somehow send you something, if not test you, and say, like you said, here's the pills, take these, and we'll see how the results go.
Yeah, well, you know,
Because it's not something where they have to keep on ongoingly taking that stuff, correct? It's a one-time transplant.
most generally, but you know, it's, I've read where people are actually trying some of this at home. You know, I guess they're taking their friends, or family stool, and, you know, probably taking some sort of enema, but, you know, it's, one of these things where it's a very stupid thing to do right now.
Yeah.
I mean, there's a lot of ways to describe it, but it's just very stupid.
And parents, being a big advocate for children, you need to definitely make sure that you consult not one, but at least get a second opinion to check on if you're going to have this procedure done with your child, because as most pediatric, the affiliations with the NIH and CDC and the American Medical Association that actually allow this or do this, because in some states it's only one place that does it for the whole state. They'll tell you that your child has to be at least 1 year old or older for them to perform this. And I'm just trying to figure out, I'm sure there are tests, but how do you know that's not a diet imbalance or something until the child gets a little older? You know how parents are. The latest fad, I'm going to do this with my kid.
Well, I mean, I think obviously you have to see what's going on. What's the diagnosis of the child? What is it? And, you know, kids can get C. diff infections as well.
Right.
But most generally, it's somebody over 65 in general. And one thing else that I wanted to add about the whole thing about the fat person, skinny person thing, and I wanted to go over donors, but the donor cannot have a BMI or body mass index greater than 30. So that's there. And then the donors, I found this to be extremely interesting. When this was first started, people would use friends and family and that sort of thing.
Yeah.
And now they're having like, the donor has to be vigorously tested, like for HIV, hepatitis, autoimmune diseases. They can't have any kind of history of abdominal surgery. So it's the donor, you know, the tests for that are expensive, and insurance does not cover that, those tests for the donors.
Well, and we don't know this, but, you know, there are stool banks now.
Yeah.
Like blood banks, which I think Open Biome is one of the largest nonprofit organizations that collects it, screens it, store stool from healthy donors, because they do all the, like you're saying, all the checks and balances on that.
Yeah, the insurance doesn't pay for the actual procedure, they pay for the colonoscopy.
Right.
They pay for that, like the doctor will do a colonoscopy, and the colonoscope has like a channel to where, like, you know, if you have a polyp, they put a wire through there, snare the polyp, take it out. Well, in this instance, that open channel in the colonoscope is used to irrigate the patient's colon. And what they do is they take frozen stool, they thaw it out, they put it in a syringe, and they inject 250 cc's into the various aspects of the colon, all the way, you know, we talked about the ileum being the last part of the small intestine, but the colonoscopy will reach the ileum. And so once they reach that, then it goes ascending colon, transverse colon, descending colon, sigmoid colon, and rectum. So all of those areas of the colon receive a certain amount of stool from the donor. And so it's becoming to the point where, you know, C. diff, the first line of treatment is usually an antibiotic called Flagyl by mouth. You can use IV antibiotics as well. And then if it gets a little worse, you can try vancomycin. And then one of the indications for fecal transplant is if you're tapering vancomycin and it's not working. So that's one of the indications for it. But
So what is the cure rate? I know I did some research, but I'm just curious, does it depend on what the gastric problem was?
well, you know, the thing that's used for is Clostridium difficile or Clostridium difficile.
Yes.
And if you use antibiotics alone, the recurrence rate is pretty high. But if you use fecal transplant, it's 90% effective.
Yeah.
And then if you have a second, if you have a relapse and you have a second fecal transplant, it's 95% effective. So you can be cured, but the thing about this is that C. difficile is extremely contagious. I mean, you can get it from light switches.
Oh, wow.
You know, I mean, you can get it from tabletops, light switches, so it's extremely contagious. And the other point I want to make is that the cavalier use of antibiotics. I can't tell you how many times friends, family will call me up and say, I've got, I've been coughing, I've been sneezing, will you write me a prescription for an antibiotic? Or, hey, I was not feeling well, my dad had some antibiotics laying around the house, so I just started taking those antibiotics. So how many times have you seen stuff like that?
Oh, a lot.
Yeah, and so that is extremely dangerous because it's the antibiotic use that will throw you potentially into an increased risk of getting a C. diff infection. So, and it's usually one of the most common drugs is amoxicillin. So how much is that used, you know? So it's the cavalier use of antibiotics must stop. Don't take anybody else's antibiotics. That's one of the major take-home points. Don't take anyone else's antibiotics because you're setting yourself up for things you don't know about, and they can be life-threatening. So
I found it fascinating, you were saying earlier about interspecies species, whatever name you want to give it, that they're doing studies now to see if they can help with like neuropsychiatric conditions, obesity, insulin resistance, people with diabetes, and autoimmune disease, amongst other things. So there are the medical establishment is starting to perform, a lot of studies, which are studies you should be funding, not looking at a couple of rats and see how well they do when they transition on cocaine, and then you cut the cocaine off of them, for tens of millions of dollars. But these type of studies are important because they can actually, they can help because there's a kind of like your JAMA magazine, Journal of American. There's the gastroenterology one that reported that the C. diff infection, they did a study across 20 North American practice sites that were part of the study. And like you said, it was about 90% of the patients were successful. And after about 112 of those patients were followed up on at 6 months, they only had a 4% reoccurrence. That's pretty impressive, actually.
Yeah, it's
gross as this subject is, unless you're a certain person on Fox News, Greg Gutfeld, who loves the word poop. This is a gross subject, but it's a medically necessary subject if you're somebody who's suffering from these conditions.
Yeah. Oh, yeah. I mean, it's going to be the wave of the future. The other thing, you can have like a universal stool donor, like you have a universal blood donor, and so that really is helpful because if the donor passes all the tests, so they don't have to go repeat all these tests on another donor.
You're like, I'm O negative, so every time I go, they said, you're a universal donor, but you can only take O negative blood. And I said, well, you need to take some and keep it for Labor Day.
Well, and the other thing too I thought was interesting is that if you wanted to make some money off of it, a universal donor makes about $10,000 to $12,000 a year donating stool.
There's your side hustle, folks.
That's a side hustle, right?
Yeah.
And but it's only about 5 to 10% of people who desire to be doing that qualify. So, I mean, it's extremely, well, you got to think about it. You are injecting definite foreign material, wouldn't you say?
Absolutely.
But again, they're going to be looking at this for cardiovascular disease, Alzheimer's disease, Parkinson's disease, and to name a few. They're studying the microbiome, and they're calling it what is its signature, meaning like they're trying to identify and isolate the best bacteria for it. And so they're actually using some RNA sequencing to try to discover which bacteria are best suited for this. And here's the indications for fecal transplant, the latest that I saw. After 3 recurrences of infection and antibiotic tapering using vancomycin, if that does not work, fecal transplantation is indicated. Moderate infection with no response to antibiotic within 1 week was another indication, and severe complicated disease with no improvement after 48 hours. Those are usually patients in intensive care unit. And in those patients, it's about 70 to 80% effective. And before the colonoscopy, the patient's prepped just like you would be like if you were looking for polyps, just a screening colonoscopy. So you have to take that prep, and then you're given antibiotics, and you're also given Imodium, which is to stop the gut. We talked about the gut as being smooth muscle too. It just moves things forward. So after they inject or irrigate your colon with stool, they don't want you to poop it out. So they want the gut to slow down. So the longer that's in there, the more effective it is. So that is part of the treatment thing. And most people, they say like, well, who would want this? But I can tell you, people who are suffering from all this, they're begging for relief.
Yes.
They're begging for relief.
Don't try anything.
Yes, and so I just think that, and one of the things too that should be noted, I mean, all of these things you have to take into consideration, because think about it if you're a patient. Like, okay, you've got a condition where you meet the criteria where you require a fecal transplant, and then during that transplant, the surgeon or the gastroenterologist sees like a polyp or something like that. They're not going to snare that polyp and remove it. It's going to require another procedure, because they're there for one reason and one reason only, and that's to to cure you of what you've got now. So people might be upset, saying like, well, why didn't you get that while you were there?
Because I need that second insurance payment.
Well, really, it's the focus of what they're doing, and it's the safest thing to do. But one of the things that, as a surgeon, that when a person has Crohn's disease or ulcerative colitis, would come to see me, they were sick. I mean, they were sick, and I'm very sick. And it's usually because of a bowel obstruction, toxic megacolon, usually like a consult in the hospital, or they've got like fistulas that we had talked about. So it's a serious problem. I mean, it's the quality of life for somebody that has inflammatory bowel disease, even though they have medications, that have vastly improved care. There's like steroids and things like that. There's side effects that are serious from these medications. And, we know that scientific research has shown that the microbiome of these patients with inflammatory bowel disease is unbalanced and unhealthy. But they don't know enough yet to where the FDA would say, like, that's an indication. Because some of the studies that have been done have shown some improvement, but the studies are too small. You need more of a randomized prospective double-blind study that's large in scope, so you can start making some statistical analysis of it to see if it meets the criteria. But I can tell you,
There's a commercial.
Yeah. Oh yeah.
Are you suffering? Would you like a fecal transplant? We are conducting a study.
Well,
Please call this 800 number.
It's all a matter of time. It's all just a matter of time.
Or if you want to be part of our advanced study, please go to 1-800 fecal transplant, or go on our app, interspecies feces.com.
There you go. But here's the thing, this is another kind of take-home point, I think. If you've got Crohn's disease or ulcerative colitis, even though it's not FDA approved as of yet, there are studies using this. And the people that I've seen who have Crohn's disease and ulcerative colitis, those people suffer a lot.
Oh yeah, I know a couple people, and they're to this day still suffering. And as a matter of fact, I'm going to make sure they watch this podcast because I don't think they have a clue about it.
And then, I'm just saying that I think that patients who have this, I think that they need to, again, watch this podcast. And if you are being treated and you still are having a lot of problems, I would look into fecal transplant as a solution to my problem. And I think that it's just going to be more and more used as we find out. I think the whole thing is going to be just an exploding industry. It's going to be a multi-billion dollar
this
industry.
is not every gastroenterologist does this, correct?
No.
So you're going to have to research in your area, whether state, country, whatever, and find, because there's a good chance you might have to travel to get this done.
More than likely.
But the probably relatively short-term, mid-term, and long-term success for a healthy gut is well worth it.
Oh yeah, I mean, I think that this is really the tip of the iceberg, and it's going to be. I think it's going to be the wave of the future in regards to drugs and medications for therapies and all these different diseases. Because as we are discovering and as we discuss, how many diseases are resulting from leaky gut syndrome and all that sort of thing, and just have an unhealthy microbiota in your system. Right. And so this is going to be something that's evaluated and put to use, I think, on a very wide scale. And again, interspecies feces, you heard it here first, and I believe it's going to happen. I know it's going to happen. It's just a matter of time. And that's really all I got.
And as people are probably saying, that's enough.
Yeah. And I think that we should be commended for not using the obvious jokes
because
they don't stop. They don't stop.
Yeah.
And so I would like to keep an air of professionalism here. Yeah. And when I talked about the interspecies feces, even though I talked to my wife about it, who's obviously into all this gut health and everything that the pharmacist says, But she said, well, now on first glance, you know, when I first heard that, I said, you are just totally out of your mind. And then she said, like, you know what? I think there's just given the circumstances of this world and everything that we're seeing, she said, I couldn't rule it out. And I said, thank you very much. So I'm not so abnormal after all. So, what can we say?
Yeah, you know, well, you might be close. I don't know if they could go longer, but in World War II, you had the Bedouins use camel feces for that very thing for, you know, German soldiers in Africa during World War II.
I didn't know.
The NIH put that out.
Yeah.
Yeah, so my little chart.
Yeah, well.
So yeah, you're, and no one else has really talked about it, but you've given it a name now, so maybe the Nobel Prize for name giving might work. So we appreciate it, and we'll see you guys as we continue on in our quest to bring you informative yet entertaining information that you need.
See you later. Thank you.
Thanks for listening to the Dr. Frank and Steve podcast. If you enjoyed this podcast, please hit follow or subscribe on the link provided so you can stay up to date on new episodes. Until next time, stay healthy and stay safe.